I'm a social worker at 4Change Association, and I'm working with the elderly for 10 years now. I will tell you a little bit about the association I'm working with. It is an association established in 2012, and we are a group of specialists that we want to bring positive and major changes within the NGO sector in Romania, and of course in our community we are living in. Since 2012, we implemented 17 projects with European funds all over Romania, and on different areas such as social services, educational services for children and adults, professional training for unemployed, but also for employees, community development, lobby and advocacy. We had over 10,000 beneficiaries from 7 Romanian counties, and we are accredited as a professional training provider and also as a social services provider. And in 2016, we were the only social services provider for elderly in Giurgiu County, a rural area in southern Romania. We are founding member of SeniorNet. It's a network, a national network of services providers for elderly in Romania, and also a member of the Federation of Non-Governmental Organizations for Social Services. We have as a mission to help civil society to become a relevant actor in developing welfare in Romania. We want, like, our vision is that all vulnerable people to have access to professional services within an inclusive and sustainable community. Very quickly, I will tell you about our project because we have project also with children, not only with elderly. We have this big project in Giurgiu County. We are placing Giurgiu County on the educational map, and 688 children are receiving a very complex package of educational programs. We have these two projects. These are projects we are implementing right now. These two projects we are implementing in 2 high schools in Prahova and in Giurgiu, and we are helping students to work in practical environments so as they will be better prepared to work when they will finish the school. And of course, we have these 2 big projects with elderly. The project we that are now interesting for this project with robots. So we have this project with another partner NGO in Buzău in Moldova County, where we are giving social services and medical services to 200 elderly from 3 rural communities. And also we have this other project, Together Against Elderly Isolation in Romania, implemented with Crucea Galbenă Foundation in Buzău, actually, where 160 elderly from 3 rural communities in Buzău and Giurgiu County also receiving home care services. What we are actually doing is we are offering home care services for the Association for Change, home care services for 45 elderly in Kosovo and Crevedia Mare, meaning household maintenance, personal care, socialization, social assistance, and material help. And we have 2 very important, let's say, activities. We have this Community Elders Club. It was for the first time implemented such a project where elderly are taught how to be active in their community. They received some smartphones, and they will were taught how to use them in order to take pictures of the problems in their community. With these pictures, we will do an exhibition, and important social actors will be invited to this exhibition: the mayor, teacher, priest, doctor, businessman, etc. And also a written document with elderly's idea about improving their community will be written and submitted to these authorities in order for those authorities to take the necessary actions. And also children from local school will be involved in the same process, and the joint exhibition will be arranged like a cross bridge between generations. I have to say that working with this kind of beneficiaries, it was very hard last year, and the pandemic affected us because we had to adjust our activities, and we didn't socialize so much with the elderly as we wanted to. And here, I think if we had some robots, it would be so good for us. And now we were flexible, and we were forced to think outside the box. We communicate with each other and with our beneficiaries, and we try to find the best solution to our problems. And our team is made only from girls. And now I will talk about the elderly's needs, and which is important for our project. So I have a case study here, and I have a lady of who has 74 years old. She lives alone. She has no pension. She has only minimum income of 55 euros per month. She has no children. She has medical problems, big medical problems. She has hypertension, a leg fracture, decreased mobility, decreased visual sensitivity. And within our project, she receives home care services and social counseling. And of course, concerning other needs of our elderly, I have to say that I have to explain to you that our beneficiaries are so-called social cases. So our elderly are living in poor condition. Mostly they have minimum income. They are living, many of them are living alone. They have big medical conditions. So their needs are not very easy to fulfill and to be answered with. So I will talk about physical challenges. So losses at the sensorial level: hearing, eyesight, smelling capacity, taste and balance, motoric limitation, walking difficulties, diminished resilience, promptitude, diminished promptitude, flexibility, balance, muscular strength, osteoporosis, cerebral changes, decreasing of the brain volume that can cause some cognitive impairments or dementia, chronic illnesses that can cause chronic pain, cardiovascular pathologies, respiratory problems, metabolic dysfunction, diabetes, cancer. And we have emotional and mental challenges. I have to raise attention here a little bit about the differences between the third and the fourth stage of aging. Especially said that we have this third stage of aging between 60 years old and 80 years old, and the fourth stage of aging above 8 years old. So somehow the needs are different also. So, but generally speaking, we can talk about anxiety, depression, sadness, acceptance or and resignation over life situation and negative emotions. But also specialists said that elderly have better emotional stability, better control over negative emotions. Emotional dynamic is not the same with the somatic dynamic sometimes, and the third age is happier than the fourth age. We have social challenges. These pictures are pictures of our beneficiaries, so they are real. They are not from the internet. So our beneficiary deals with poverty, loneliness, reduced social relations and social isolation, loss of the partner, challenges in their relations with family, difficulties in accessing community resources and understanding society changes, lack of opportunities for socialization. We have also cultural challenges, intergenerational gap, difficulties in interacting with the new technologies, reduced role within society. Example, in Romania, most of the elderly are seen as only having one role of grandparents, for example. Society perception, old people are rather a burden than a resource. And of course, I have to tell you about. I have to tell you that not. I mean, 90% of our elderly are facing problems like this, but we also have some elderly that are happy that they reach some sort of serenity and acceptance of their problems, and they are involved in this community development program, and they are interested in giving us their ideas, their experience. But most of our elderly in our programs, they need big help. So it would be very interesting to see how robots can help us with this, improving the life of this elderly. Thank you very much. And if you have some question.